In this scenario, we're going to look at how you should answer an AKT question knowing that there are two popular guidelines, which have subtle differences in their management plan. So the difference that I'm referring to here is between the NICE asthma guidelines, but also the BTS asthma guidelines as well. So in this scenario, you have the same 25-year-old patient from the last scenario, but they're now taking a short-acting beta agonist and an ICS. So what would be the appropriate next stage for this patient? So I want you to have a think about the treatment ladder and what the next step would be for their asthma management. So there are two options for this answer, and this is the real difference or the most significant difference between the two algorithms. So you're left in a situation where you either go for a leukotriene receptor antagonist, which is what NICE would suggest, or you go with a long-acting beta agonist and or a MART therapy, which is what SIGN would suggest as their next stage. And effectively, the difference between the two is that you flip them around. In NICE, you would go for montelukast, and then you would go for a LABA at the next stage, whereas with SIGN, you would actually try the LABA or MART first, and then add in a leukotriene receptor antagonist afterwards. So, in an exam scenario, if you were tested on the next stage after the low-dose ICS, in a fair exam question, you should actually just be given one of the two options that are correct. But what you might find is that they may give you step 3, so the patient may already be on a LABA, and if that's the case, then you know actually the next stage might be montelukast, or you might be given a situation where the patient's already taking montelukast, and then you're asked about the next stage in that management plan, and the natural plan then would be the LABA because you're then going off NICE guidelines. So I hope you found this useful. I know it can be tricky when there's more than one guideline in mind, but this is really important, or there's a really important point here that you should know both treatment algorithms. I hope you found this helpful, and that's a wrap on asthma. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.